The topic of today's video is cognitive behavioral therapy, or CBT. So what is CBT? CBT is a counseling methodology that focuses on the interactions between a person's thoughts, behaviors, and emotions in order to help bring about change. CBT identifies three layers of cognitions. They are core beliefs, which are the hardest to change, and these are things that impact how we see ourselves. Our underlying assumptions, the second layer, are based on our core beliefs, which help us predict how we will interpret the way in which the world operates. Automatic thoughts are thoughts that we have, which might not even be noticed by us throughout the day, and are based on how our core beliefs impact our underlying assumptions. So for example, if a student's core belief is that they are a failure at school, then their underlying assumptions will be based on that belief. They might feel that regardless of what they then try, they will not succeed, which can then lead to automatic thoughts that are negative, such as, I'm about to fail another test. My approach to CBT focuses on challenging thoughts for a simple reason. We often will believe what we think, even if what we think is not really true. A teen could believe that their friend ignored them at the mall, a negative thought, which could lead to sadness, a negative emotion, and maybe even a fight, a negative behavior. But what if their friend never knew that they were actually there? So the friend didn't even know that the teenager was at the mall. By putting thoughts on trial, instead of actually the person, my client and I will examine together whether these thoughts are supported by evidence or not. If not, then we work on understanding why they're having these thoughts, and then try to find ways to restructure their thinking. If evidence, though, supports these thoughts, then the focus will probably be more on the behaviors that they might be doing and that are creating the reality that they are experiencing. One thing that I never do, and I encourage all my clients to not do, is actually challenge their emotions. Whatever you are feeling is what you are feeling. If you don't like it, there are ways to work on your thoughts and your behaviors to try to make your mood better and your emotions better. But if you don't accept your emotions and if you get mad at yourself for being upset, then all you're going to wind up doing is actually making yourself more upset in the end. So thank you for listening. If you have any questions, please feel free to reach out. My phone number is 416-613-1259. And by email, you can reach me at kevin@hhcw.ca. Have a good day.